In this video, we will talk about artificial lenses, sometimes referred to as IOLs or intraocular lenses. These can be placed in the eye in place of the natural lens after cataract surgery. And there are various types of artificial lenses, including monofocal lenses, toric lenses, and multifocal lenses. And we'll talk more about these in this video. So the history of artificial lenses is actually quite interesting. The idea came about in World War II when pilots who suffered from penetrating eye trauma from plexiglass explosions actually tolerated the foreign bodies in their eye well for many years. And so people thought, hey, if we make artificial lenses out of plexiglass and place it into the eye after cataract surgery, chances are that the patient would not have any adverse reaction to the foreign body. So in 1949, the first artificial lens in the world was implanted in London, and 3 years later, in 1952, the first artificial lens in the United States was implanted at the Wills Eye Institute in Philadelphia. So what are artificial lenses made out of? Well, typically they're made of inert, non-reactive materials. Now, PMMA used to commonly be used, and this was the former gold standard, but it has since fallen a bit out of favor because it can't be folded and is thus not conducive to less invasive surgery. Silicon, also more commonly used in the past, again is less suitable for microincisions. Though interestingly, some of the newer accommodating lenses, such as Crystalens and Trueline, are actually silicon, and I'll talk more about these in just a few slides. Nowadays, more and more cataract surgery is using hydrophobic acrylic, which is very flexible and very easy to fold. So the most commonly implanted type of lenses are monofocal lenses, and as its name implies, these provide one type of focused vision, so either near or far, but not both. Patients can actually choose whether they want good vision at near or far, but often most patients will choose to have good distance vision and use bifocals or reading glasses for near vision. Monofocal lenses are generally fully covered by insurance and Medicare, and on the right is a picture of a monofocal lens. It has these two small arms called haptics, and these serve to hold the lens in place in the capsular bag in the eye. So some patients with cataracts may also have astigmatism, and for patients who do not want to be affected by astigmatism after cataract surgery, they can choose an astigmatic or toric intraocular lens. Now note that in order to properly correct the abnormal corneal curvature in these patients, these lenses must be very precisely rotated to the correct position when being inserted during cataract surgery. Now, unlike the monofocal lenses, these are typically not covered by insurance and Medicare, and typically involve an out-of-pocket expense. So now the problem with monofocal lenses and even toric lenses is that they only provide clear vision at one focal point, typically at distance vision. So patients will need to wear reading glasses for near vision. So what if a patient doesn't want to wear glasses after cataract surgery? Well, there are three potential solutions, though each has their pros and cons. So monovision can provide clear vision at both distance and near after cataract surgery. It's not a separate type of lens, but just refers to a general strategy to allow patients after cataract surgery to see objects at both near and far. So it involves implanting a monofocal lens in one eye for distance vision, and implanting a monofocal lens in another eye for reading vision. Now, as you might imagine, this might not work well for all patients, as these two very different focal points can be disorienting. And because of this, patients are often asked to experiment with monovision glasses or contact lenses before their cataract surgery. Now, another strategy to provide clear vision at both distance and near simultaneously is to implant a lens that flexes like the human lens and works with the body's own ciliary muscles to provide a continuous range of vision. So here's an example of a lens, and it has these more complex haptics and loops that allow the lens to move with the ciliary muscle, allowing the lens to adapt to both near and far vision. Now, typically these are not fully covered by insurance and Medicare, and therefore require an out-of-pocket expense. Examples of products currently on the market include Crystalens, which is shown here, as well as Trueline Toric, which can also correct astigmatism. And a final strategy that might be used to provide clear vision at both distance and near is to use multifocal lenses, which actually consist of concentric rings of lenses that alternate between focusing at distance and near. Now, unlike the accommodating lenses, these are not flexible and do not move with the patient's own ciliary muscles, but they still provide good vision at multiple focal points. Now, compared to monovision, they have the advantage that one eye can see both near and far, but at the expense of a little bit of visual acuity. And so this is not routinely recommended for patients with glaucoma or macular disease. Now, side effects of these lenses might include glare or halos around lights, and Restore and Technis are two examples of multifocal lenses currently on the market.